Okay, so right now we're prepping this patient for surgery. He's going to get neutered, so before we get him into surgery, I'm just going to make sure that I check his bladder and express it. So what I'm doing here is using one hand and just kind of feeling caudally for it. It does feel very small. Usually what you can do is put one hand underneath and kind of push it up, and with your other hand feel for it. But to be perfectly honest, his urinary bladder feels almost non-existent. Yep. So if he were to have a full bladder, we would express it before surgery to help the doctor. But he must have urinated before surgery, so his bladder is nice and small. That's how we would express a bladder before surgery. So we are in the middle of a neuter procedure right now. The doctor is prepping for with all her instruments, just monitoring anesthesia beforehand. Things that I'm looking at here are ECG, so our kind of overall heart rate, our SpO2, which is our the blood circulation, the oxygenated blood throughout the body. Our end-tidal CO2, so the amount of carbon dioxide that's coming out with every breath, and our blood pressure. So right now I'm kind of working on getting our blood pressure reading better, because he's a small dog, so we're just making sure that our cuff is correct, is the right size. And I do also want to make sure that we have our temperature probe in, because we are a smaller patient. Okay, and that way that'll give us a little bit of a better reading. So our waveform kind of, what happened? So you can see that our waveform kind of went away a little bit there. I'm going to adjust this because I do believe that the patient is still doing all right, that it is just our machine. So when you're monitoring anesthesia, one of the things you want to double check with is that if your machine, if your machine is, if you notice any abnormalities with your machine, that it is just the machine and not the patient. So I'm going to adjust our SpO2 here a little bit. That's on our tongue. Our heart rate is a little high. Would you like? Never mind. That's better. Yes. Okay. So now that we've started the procedure, you can see that our heart rate has increased a little bit. Can probably feel this. May increase anesthesia a little bit. We're still breathing all right. Our SpO2, so our oxygenation, is at 100%, which is a great number. Gonna give us a little bit of a breath. Our temperature is now reading 98.9, which normal for dogs is between 99 and 102.5. So that's normal. I may expect that to drop a little bit while under anesthesia, but not too much. So we'll just keep an eye on that, and we'll be getting our blood pressure reading properly. So yeah. So with our autoclave, you want to make sure that it is as clean as possible, because as the main sterilizing unit in our hospital, if the items aren't coming out sterile, then there's obviously a problem. So we deep clean this once a month. The way you deep clean this is by using two components: distilled water, because regular water can breed bacteria, and this speed clean product. So one of the first things that we do is empty all of the distilled water out of it. Empty all the distilled water out. Then we take some of this product and wipe some of the instruments that are in here. So we'll wipe the trays out. And what this does is that it gets rid of any grime or any kind of buildup of the distilled water, if there is any. Then we mix this product with some distilled water, put it in the machine, let the machine run for an entire cycle, empty all the distilled water out, or all of that water out again, fill it back up with distilled water, and then let the machine run a cycle again. So there's a couple different cycles. It usually takes a couple hours to make sure that the machine is totally clean. Afterwards, we'll also clean the inside of the machine with a little bit of distilled water as well and a cloth, just making sure to get kind of the ins and outs of what's in there, as well as the door. And then also once a month we will run a spore test. So we take essentially almost like a little envelope, we put it in the machine with other packs, and we send this test out to a lab that makes sure that there's no spores or any bacteria that come up positive on this test, because if it's not, it means that our machine is dirty and it's not sterilizing. When we are finished and we do start sterilizing, when we put packs in, when we take them out and they're finished being sterile, we have this tape on the outside, and that shows us that the outside of the pack is sterile because it changes color. So if I were to take a pack and put it originally in, it would look like this. And when we take it out after it's sterile, these lines darken and indicate to us that it's a sterile pack, as well as we have a sterile indicator strip on the inside. So we look for that as well. This will also change to be dark and let us know that the inside of the pack is sterile.